Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
Mountain Moving Faith. This is my latest book. And if you want to learn how you can move mountains, life has many mountains. While this journey, you will encounter mountains and you wonder, how can I move mountains? This is a book to read. And it took me time to research, to pray, and to wait on God and look at the scriptures and what Jesus talked about moving mountains. And this book is quite a story, it's quite an inspiration. It is quite something that will change your life. So order your copy today. We can send it to you wherever you are in this country. We will be able to send this book to you on Mountain Moving Faith. Call that number or send a message and our team will be able to ship it to you wherever you are. There's a book to read. You can also buy for your friend, for a family as a gift. And I have no doubt they will thank you and they will be always thankful for what you have done for them. So God bless you as you read this book, Mountain Moving Faith.
Hello there, welcome to the Healthy You program, your favorite health program on Faith Today television. My name is Enock Kitondekijja, a medical clinician and your host today. Allow me to start by recognizing our sponsors. This program is brought to you by JCK Hospital. JCK Hospital is found in Roysambu along Lumumba Drive, just next to Happy Life Children's Home. We are also in Mariaini, that is in Muranga County. You can also find them in Juja Farm, that is next to Happy Life Primary School. Welcome. We are so passionate about health and emphasis is on bringing you value, knowledge concerning your overall well-being holistically. That is to say, health for the body, soul, and mind. Tonight is a great day. And we're going to be talking about a very critical condition. When I talk about pneumonia, what comes into your mind? I know for some, for the mothers, you have encountered scenarios when the doctor diagnoses pneumonia and you wonder, what am I also going to do? We've seen those who have suffered from this disease. Some have recovered from it, and unfortunately, we have had stories of those of our friends who have succumbed to it. So tonight we want to really understand, and because we are in a modern world, the question is, should pneumonia claim lives in the modern world? And to help us unpack this wonderful conversation is no other but a very good friend of mine from JCK Hospital. And like you, she is a medical officer. But before I introduce her to this show, I want to remind you to follow us on Facebook. Those of you who follow us on YouTube, remember to like. Those who share this program, you do so well to help us reach thousands of people with this great information of health. Now, without any further ado, allow me introduce our guest today. Welcome to the show, Doc. Kindly introduce yourself to our viewers.
Yes, thank you for inviting me to the show. My name is Dr. Jackline Wangechi, a medical officer, and I work at JCK Hospital. I am very happy to be here to talk about pneumonia today. Thank you.
Doc, welcome. And you're really smart. Is that how you look when you are at JCK?
Yes, every day.
Okay.
Yes.
So if I don't find the coat on, I'm seeing the wrong person.
Yes.
Oh, that is Dr. Jackline for you. She's right here to help us understand this. So if you are watching this on Faith Today Television, please invite your neighbors. Let them come and join you as you watch this live. Could you kindly tell us about your role in JCK Hospital? What do you really do there?
Yes, so I'm basically, well, a medical officer is basically a doctor who's done a degree in medicine. So I see the patients, just the day-to-day daily diseases. We also do a lot of maternity care, doing cesarean sections, and also I'm the medical in charge. So also make sure the team there is on their toes and we're giving the best care we can to our patients.
Oh, that is interesting. Cesarean section meaning, are they operations or what?
Yes, it's an operation where you deliver a baby through a surgery.
Okay.
Yes.
That's quite interesting.
Yes.
And today we are talking about pneumonia. I'm sure that is some of the one of the conditions that you really encounter. Could you kindly give us an overview of this condition?
Okay. So pneumonia is a very common disease that we see daily, actually. And pneumonia is basically an infection of the respiratory system that goes to the lungs. So you'll find there's inflammation in the lungs, and if it's very severe, you can get even fluid in your lungs. You'll have problems breathing. Yes, so it's basically an infection of the lungs. It's an airborne infection. So we saw that a lot during even the COVID, where we were told to wear our masks, because if somebody has pneumonia and they are coughing or sneezing next to you, you can easily acquire the disease. Yes, and pneumonia is, most of the patients we see, the cause is bacterial, but it can also be caused by a virus, could also be caused by a fungi, but fungal are less common. And also there are those who get pneumonia from aspiration. Aspiration pneumonia is basically where a person who is unable to control their breathing and control their gastric system, they end up like maybe you have vomiting and part of the vomit has entered your respiratory system and goes down to the lungs and causes inflammation. And because of the bacteria you got from the gut, you end up getting what now is pneumonia, the infection in the lungs. Yes, so there's also that, and that's more common like in patients who are in a coma, patients with a stroke, patients with a seizure. But in our setup, most of our patients are mostly children, especially the school-going ones, and those under 5, and those are the most that we see with pneumonia. And also other people who are at risk of pneumonia, which we saw a lot on COVID, we got a lot of education about that, even generally in the public. Patients with lung diseases, patients who have things like asthma, patients with chronic obstructive pulmonary disease, patients with heart diseases, people with heart failure, people with diabetes, people who are chronic smokers, alcohol users, especially chronic alcohol users because your immunity is altered. And sometimes what we say, you've passed out, you can't control yourself. If you're vomiting when you're passed out, you can easily get the aspiration pneumonia. Also people with malnutrition, especially children. And you see a lot of that, especially in areas like Kiambu where the diet for young children, people don't have the best education about it, so we see a lot of malnutrition cases. People with HIV, people on chronic steroid use, because the use of steroids affects your immune system. It lowers your immune reaction. So definitely your immune reaction will be lowered and you'll be at risk of getting pneumonia. So those are the clients that are mostly at risk of getting pneumonia.
Oh, that is really a great detailed overview about pneumonia. Yes. And what I take from your discussion is majorly, you've talked about being airborne, but someone can also get it from other causes, like aspiration, you know. They are managed for some other conditions, but then they end up getting the bacteria into their lungs, and then they get this pneumonia. Yes. This is a really great information to know. And speaking of how it really comes to attack us, you know, just take us through how does it present? Like, what are some of the symptoms?
Okay. Yeah. So the first thing, you'll hear somebody telling you they had the flu. They were having a cough or a runny nose. And the next thing, they were having a fever or chills. They'll also tell you they were sweating a lot at night or shaking a lot, actually more of shaking. Then there are those who tell you they just felt weak. It's generalized body weakness, but they didn't have any other obvious symptoms. There are those who will come with a headache, a sore throat. So usually a mixture of all these things. There are those who will have chest pain, or who will tell you the chest pain is really a lot when I'm coughing. So yeah, so it's a mixture of all that. And in pneumonia, there are those, there's typical and atypical pneumonia.
Atypical, there you can break it down for our viewers, because I love the speed, but we need to come along with them.
Yes.
Tell us what is typical and atypical.
Yes,
pneumonia.
So typical pneumonia is mostly caused by bacteria.
Bacteria.
Yes.
Okay, you talked about 3 causes.
Yes.
Bacterial, viral, and fungal.
Yes,
so
and the aspiration also.
And the aspiration.
Yes.
Bacteria is for typical.
Yes.
Carry on.
Yes, so for typical pneumonia is now the generalized, the fever, the body weakness, yes, and this the general respiratory symptoms.
Okay.
For atypical, there's still some types of bacteria, because you know there are different types of bacteria.
Yeah.
For atypical, there are different bacteria and also now the viruses, and the symptoms are not always very straightforward that it's a respiratory illness.
Mm-hmm.
So also there's a lot of keenness on the side of the clinician to be able to pick it up that this is actually pneumonia. It's not always obvious that you are just coughing or you had a fever, but they will have things like a sore throat, a headache, things like that, that usually come with the flu. Yes. And you know, sometimes for pneumonia, it starts as a normal flu, what we call an upper respiratory tract infection. But now when it goes down the respiratory tract to the lungs, now we change the diagnosis to pneumonia. Yes.
So in other words, you're trying to tell us that pneumonia, for you to really diagnose pneumonia, it goes beyond just you having these simple symptoms like we've talked about, the sore throat and then the cough, until it goes down the lungs. That is when you can confirm it's pneumonia.
Yeah.
So take us through, how do you really diagnose this? How do you come to a conclusion that this is not just a common flu, it's not just a cold, it's really pneumonia?
Yes.
Yes.
So in diagnosis, the first step is clinical presentation. So what the patient tells you how they are feeling.
Okay.
So once you establish what direction this conversation is going, then now you go to the physical examination. On physical examination, we'll do things like listening to your chest. You'll hear some chest sounds. You can hear a wheeze. You can hear things we call crackles. When you're having crackles.
Crackle now.
Crackles.
How do you even hear the wheeze?
Yes, so we use a stethoscope. What you have.
How do you do it? Maybe you can illustrate to us, because I'm just here, your client. You can illustrate. Should I give you the good one, or you can use that one?
I can use, this is still a good stethoscope. Yes, so I'll put this in my ears.
Okay.
And then I'll make sure it is on.
It is on. Ah, so it can be off.
Yes.
Okay.
Yes.
Kumbe, if mine was always off.
Yes, you have to make sure it is very clear, it's loud.
Yeah.
So then I'll put it on your chest.
Okay.
So I'll check the upper part and listen to the breath. Do the same on this side. Go to the sides on this side, side. Go to the lower chest region, both sides, and even to the back area.
To the back area. How do you do it in the back area? Still, do I have to lie down, or I have to sit?
No, just sitting up.
Okay.
Yes, so I listen to the upper and also the lower sides.
Okay.
Yes.
Okay.
So those, you know, there are different lobes of the lungs.
Lobes.
Yes.
Okay.
So each area you have to listen and feel if there is something, because they're different. In pneumonia, it affects different parts of the lungs. Can affect a lobe, can affect, well, that's a lot of medical jargon.
Like,
yes.
Compartments of the lungs.
Yes.
Yeah.
Yes. So the physical examination is also a very critical part of diagnosing pneumonia. Because even what I feel, depending on how bad the chest sounds are, determines also the severity.
Oh.
The other things we check are, of course, the oxygen levels. Okay. If the oxygen level is below 90%, then we are dealing with severe pneumonia. Okay. There are patients where it's so bad that they're actually turning blue.
They're turning blue?
Yes.
Wow.
Because the lungs are so affected, the oxygen transmission in the blood is affected. Okay. Yes. There are those who it's obviously they are struggling to breathe. Yeah. Difficulty in breathing. You're finding for babies, the lower chest, you see the muscles going in. Yeah. Because they are really struggling to breathe, or they're having fast breathing. Yes. So for such cases, then you know that this is definitely pneumonia. After the medical examination, we go to the lab tests.
The lab tests?
Yes.
Okay. You've
So
already, you've told us, you guys it's a procedure that you take.
Yes.
You examine me
Yes.
clearly. I can't examine from my home. It must be you guys to
Yes.
examine me.
Yes.
Then you pick out something. Then as if that is not enough, then you go to the next step.
Yes.
Is that what you do at JCK?
That is what we do.
Perfect. Take us through the investigations.
Yes. So we start with the basics,
Yeah.
which is the full hemogram for complete blood count.
Complete blood count.
Yes.
Okay.
In that test, we check for things like bacteria and the viruses. We'll have the white blood cells being elevated. And within the white blood cells, there's also different types of white blood cells that can be able to tell us, is this a bacterial infection? Is this a viral infection? Is there inflammation in the blood?
Okay.
Yes. So
Wow.
those are the basics that we look at. We can also do other tests that show inflammation in the blood. Like we will hear of ESR, of CRP. We can also go to the chest X-ray.
You also do X-ray.
Yes.
Okay. Some people fear the X-ray. I don't know how you handle them. People be like, don't put me in that photograph, don't put me in that camera or whatever.
Yes.
Yeah. How do
Yeah.
you really help them understand? You know, this is very important for you.
Yeah. So you give education to the patient
Okay.
of how this disease, it's a leading cause of death.
Yeah.
So it's a very serious thing.
Mhm.
So anything that will help us make the right diagnosis is very important.
Okay.
Yes. And nowadays there are measures to make sure even if you go for an X-ray, the effects are not long-lasting. Because of course there's a risk of radiation.
Okay.
Yes, but there are protective measures in place that there's nothing wrong with getting an X-ray. And this is a very important indicator in diagnosing.
Wow.
Yes.
That's very important. For those of you who have just joined us, we are just getting started. This is Dr. Jackline from JCK Hospital taking us through pneumonia. She has talked about very important points that you do not want to miss. You cannot diagnose this from home. It is a process that these people take you through. They examine you, you know, they look out for certain key areas. For them, they know you may not know this. And it's important that they help you understand this. And it's also very soothing to know that they will also give you that knowledge and the information that you need to know as they are taking you through all these processes. We've also learned that they do an investigation. They go an extra mile to now narrow down to the real cause of this pneumonia. Earlier, you realize she talked about the 4 kinds, you know, but the management is totally different. She has also helped us understand the symptoms. How does this present? Because if you miss this, most people just do not turn out to come to the hospital, and they become worse and worse and worse. And yet what we want for you is to improve, get better, and have the best outcome of this. So doctor, take us through now you've finally gotten what you are looking for. You've taken the blood tests, and then you've made the diagnosis. How do you even confirm this is pneumonia, and then how do you manage it? Yes.
So, well, the blood test is a basic test, because you know, in our society, we're also limited in resources. You also realize not every patient is able to afford every test. So from the basic full hemogram, you can easily treat it. Okay. But in case the patient is very severe, a chest X-ray is a must.
Chest X-ray is a must.
Yes,
in case they are
of
in
severe. Yes,
okay.
It looks like severe pneumonia.
Right.
You can also do a sputum test. Yeah, and for some patients, we also rule out things like TB, okay, which we talked about last week.
Yeah, TB.
Yeah, on this show. Yes, we also have to make sure there's none of that.
Mm-hmm.
So then once we are done with the diagnosis, we go to the treatment. So here is where we say, is it severe pneumonia? Mm-hmm. Is it just pneumonia, or it's not pneumonia, it's just a normal cold? Mm-hmm. So the treatment will be different. For severe pneumonia, we must admit you, because we have to give IV, intravenous antibiotics.
That is medicine,
yes, into the veins.
These veins here.
Yes.
Good.
Yes, we have to use that regimen to make sure that we completely deal with it.
What if someone does not really want that? They are anxious about that. What do you do for them?
Well, for such a patient, you have to give them counseling.
Counseling.
Because there are clients you cannot in clear conscience allow to not get IV medicine. They will die.
Or they will die.
Yes, or they will get into complications.
Okay.
Yes.
Because
so
some of them will give an
not.
excuse. Me, I can swallow. Why do you pass here when I can swallow?
Yes. Especially for children and the older population, we do not take it lightly. Okay. For a young, healthy adult, we can bargain, but yes, for children and older people over 65 years, we cannot. Yes, so we'll give counseling on that. Those who refuse completely, will have to be closely monitored.
Okay.
Yes, so you can also give high dose antibiotics, but now not in severe pneumonia, in just pneumonia.
Yeah.
Yes, you can give high dose antibiotics, but we also review you after 3 days. There also has to be that close follow-up to make sure there is improvement. Because there are those who give oral antibiotics, and there are actually people you'll hear saying, I'd given my child medication at home for 3 days or 5 days, but there's no improvement. So yes, there has to be close follow-up to make sure we are doing the right things.
Do you guys follow up?
Definitely.
How do you follow up?
We always ask the patient to come back. Okay. And for those who are very ill, I can even call you myself to ask.
Like the doctor calls me?
Yes.
Okay.
To make sure you're fine, depending on how severe, because there are those cases there has to be close follow-up. Mm-hmm. Yes. You also realize we deal with different demographics of people. Mm. So there are people you'll also explain to the severity of the situation.
Demographics meaning?
Like in terms of education level, in terms of finances.
Okay.
There are people who might want to get the right medical care but cannot afford it.
Yes, yes.
Yes. And sometimes you find like the hospitals are striking, the public hospitals, so this patient does not have an option. For in such cases, that close follow-up helps. But you try and everything you can in your power to make sure this patient gets well. And in terms of demographics even, sometimes somebody did not fully understand because of maybe the education level, how serious it was. So that close follow-up helps in the outcome of the patient being good, that you made sure everything went well. They completed the full regimen. Okay. Yes, because you always hear people saying, you give them antibiotics, can I drink this with alcohol? And you're like, no.
You know?
Yes, and complete the 5 or 7 days you've been told to do it. Mm. So yes, you also have to, that follow-up also helps to make sure, did you take the full dosage so that we are being effective in our treatment. Okay. Yes.
Oh, that's quite interesting, and I learned a lot that you guys are systematic, you know. It is a procedure, it's a process that you take someone through before you even initiate them on drugs. Because there is a challenge of today, we have pharmacies all over, drug shops all over. Someone just gets to know, okay, I have this, probably this could be the problem. They go and they, over the counter, have these drugs, have this, you know, treatment and things like that. What do you have to say about these the people who self-medicate?
Yes, yes. I strongly advise not to self-medicate, strongly. Because, like I told you, the pneumonia is caused by different things. Yeah. So if you self-medicate, how are you sure you're treating the right thing?
How are you sure you're taking the right thing?
Yes, like even in terms of the dosage, in terms of what bacteria are we targeting, how are you sure? Yes, of course, in terms of like antibiotics, we have regimens that we use. We know if I see this is the first line antibiotic. If that doesn't work, this is the second line and all that. But you see somebody at a pharmacy selling to you drugs, does not know that. They don't. You yourself, because I hear people like, well, let's say for example, somebody's having diarrhea. A lot of people just say, let me take Flagyl. Yes. Yes, what if it's H. pylori you're treating? That won't work. And of course, the other risk with buying over the counter is having resistance to medications. The more you keep exposing yourself to antibiotics unnecessarily, you're giving the bacteria in your body a chance to be resistant to this medication. So the day you actually need your antibiotics, we have to now struggle to find very strong antibiotics to be able to treat you. And you see, even as a country, if we encourage this culture of over-the-counter medication, especially for antibiotics, then we start having mass resistance. Then it makes it very difficult for us as healthcare givers to be able to treat diseases. Because now we are thinking, now what is the next strongest thing? And that is very dangerous to be in that situation, where you are resistant to most medication. How do we help you? Yes, the risk of death becomes much higher.
And I love the assertiveness that you are giving to this. I see the facial expression. Doctor is trying to tell you, please do not self-medicate. We all understand right now, for those of you who have just joined us, the various causes of pneumonia. They want to help you identify, single out that what is causing whatever you are going through so that they can deal with it. Because it's trying to also help us know that people are going in for antibiotics, yet probably it's a viral, you know, cause or something like that. So they are trying to help us. And this is brought to you by JCK Hospital once again. Those of you who are following us, you can find them in Roysambu, along Lumumba Drive, next to Happy Life Children's Home. Speaking about management, doctor, help us understand because I know someone is following now, and for those of you who have questions, feel free to jot them down. You have a good quality time with the doctor. You rarely get such, time to interact with them. So if you have any question, you have an urgent idea or anything you want to know more about this discussion, feel free to comment in the comment section. We are going to pick it and answer it. Doctor, picking it from there, help us understand, how long does this take? How long does someone take through the entire process of diagnosis, then treatment? How long should it take? Because there are people who are really busy, they don't want to take long, in hospital, so they want to know that process.
Yeah.
Yeah.
Well, I'll speak about JCK.
Yeah.
In JCK, we try to, the whole process of you coming, going to triage, seeing the doctor, doing the lab work, getting your medication at the pharmacy. Well, without lab work, at least 15 to 20 minutes we are done. But in case there's need for lab work, which in the case of pneumonia, we have to be sure, it will take maximum 30 minutes for the whole process up to getting your medication. But in case we need to admit you, then we keep you for 3 to 5 days, depending on how you will be improving. The patients within 3 days of being given the antibiotic, we see a very big difference, and they can go home on strong oral antibiotics. But for those who there's no improvement, we have to do the 5 days. Sometimes you can even switch to stronger IV medications, depending on how your progress is. Yes. Okay,
so looking at all the treatment lines that you put these patients on, do they get better? Do they cure? Is it treatable? Is it curable?
Yes, definitely. Okay. Pneumonia is very curable. The only thing is early diagnosis is important.
Early diagnosis?
Yes.
Late diagnosis is terrible?
It can be bad.
Okay.
Depending on if a patient actually has what we call comorbidities. Like what I was saying, like malnutrition in children, a child maybe with a congenital heart disease, a patient maybe with asthma, a patient with lung issues, heart failure, patients who are very sick, even with other things. If you have late diagnosis, then it makes it very difficult for us to help you. We will do our best, but sometimes the outcomes are not always good, unfortunately.
Unfortunately, the outcomes are not good in case you came late. So early diagnosis is key for those of you who are following this. And then speaking of treatment and then the success, I want us to understand also, are there failures? Is it even possible, like you treat someone and then they fail to respond to your treatment, and what do you do?
Well, the typical pneumonia, not so much. COVID is where we had a game changer, because we had not dealt with this before. So where we saw failure rates before we figured out what works. But just the normal pneumonia that we see, failure rate is very low. Because we have also very strong antibiotics. We have options. That's a good thing. Okay. We can go high. Yes.
Or you can step up.
Yes. And on top of antibiotics, we also give supportive care. Yes. So the people will have to be on oxygen. There are people who will have to give fluids to help revive them. There are patients who will need even support in terms of feeding. So there's also that supportive care on top of just the antibiotics. Okay. So the failure rates are low if diagnosed early, and the right treatments, the appropriate treatments are given.
Wow, I love the word that you've used, the appropriate treatment, because there could be a number of, a wide range of them, but as long as you have the appropriate treatment, you can get through this. Yes. And then someone has, probably you've treated them, they have gotten better. Is it possible for someone to again contract this pneumonia?
Definitely.
Are there cases?
Yes, you can. Because if I treat you for pneumonia and it clears, yes, now you don't have it. But it's possible for you to go and get reinfected again, either years later or months later. Also depending on your immune status. If your immune status is low, then of course you're at risk. So if you're not taking the preventive measures to prevent you from getting...
You will stop it at that. She talked about preventive measures. Yes. We're going to take a short break, our viewers, and I want to appreciate you for keeping it Faith Today television. Doctor is going to come back and tell us about the prevention, because that is very key. She's also going to tell us about the technology, the advancements. She's also going to take us through how we can be able to live healthier, stronger in this present age. Keep it Faith Today television. God bless you.
Okay, asante. Nilikisajili kitabu ambacho kinaitwa 7 Keys to Success, ama kuna kanuni funguo 7 if you like it, ambazo zitakuletea ushindi na kufaulu maishani. Wote, wewe na mimi, tunataka kufaulu, lakini pia kuna njia ya kufaulu. Ukisoma hiki kitabu ambacho nilikiandika kwa kufanya utafiti, kwa maombi mengi, kuangalia neno la Mungu, I have no doubt ya kwamba hiki kitabu kitabadilisha maisha yako. Nilikuwa naongea na mchungaji rafiki yangu akaniambia, nilisoma hicho kitabu, sasa ninafundisha watu wangu kupitia ujuzi, maarifa, hekima ambayo nilipata kwa hiki kitabu. Kwa hivyo unaweza pia nunulia watu wengine, na akaniambia alinunulia hata viongozi wake, na wamekuwa wakisoma, wakaweka kwa library yao wanasoma. Hiki kitabu sina mashaka, nina uhakika kitabadilisha maisha yako na utabarikiwa. Tuma message ama upige simu kwa hiyo namba, na naweza kuwasiliana na wewe na utapata hiki kitabu, utatumiwa, usome na ubariki pia watu wengine. Asante. Mungu akubariki unaposoma 7 Keys to Success, and you will succeed. Thank you.
Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV. Welcome back to our show. I'm right here with Dr. Jackline from JCK Hospital. It's been a great first session talking about pneumonia. She has really helped us understand whatever it takes. You know, you can imagine more than 5 years of experience just concentrated and given to us through Faith Day Television. And those who are following us, it's really an exciting moment because I see the questions are really flooding in. It means really people are enjoying this show. Please, if you don't mind, remember to let us know where you are watching this program from. I'll begin by a few questions. The very first one is from Ruth. Ruth is saying, I am so happy to see Jackie. How do I know my lungs are 100% healthy? That is Ruth. And then the second question is, I once got pneumonia, and the whole time I was very confused mentally. Is this common with people who have pneumonia? Doctor, maybe you can start with those questions.
Okay.
That's okay.
So there are exercises you can do to make sure your lungs are working well. There are things on the phone where you can Google and they give you a timer of taking your breath for this number of seconds and then release. If you are unable to reach that range, definitely there might be a problem. Even just checking your oxygen levels, there's that SpO2 machine. There's like a small one that people really bought a lot during COVID, and it's readily available that you can use and check how are your SpO2 levels. Yes, the pulse oximeter. Okay. How are your oxygen levels? Okay. Yes, and then also, do you easily become breathless? Mm-hmm. That's also another thing you need to check. Mm-hmm. Yes, how are you? How do you sleep at night? Do you get a lot of congestion, a lot of wheezing, and all that? Yes. You talked about wheezing, but people can only get to know wheezing when they come to you. There's also obvious wheezing. There's obvious wheezing. Yeah, if it's really bad, when you're breathing, I can hear you wheezing. How does it's like a whistling sound. You hear, like that. The whistle. Yes, like a whistling sound. So in severe asthma, when severe pneumonia, their patients also have wheezing, on top of just the other lung sounds that you can hear.
Okay.
Yes. Then in the question of confusion, definitely, if the oxygenation of your blood is affected, then definitely the oxygen going to your brain is affected. So you will be confused. But now that is severe pneumonia.
That is now severe pneumonia.
Yes.
You should not stay at home.
No, you cannot stay at home. You have to go and give you oxygen, supplement the oxygen in your body.
Okay.
Yes.
Oh, that's great information you are giving us here.
Yes.
Someone is wondering, I sleep at night and my partner snores. Does she have or he have pneumonia?
No. Snoring sometimes is, not really, no. There are people who have obstruction in the upper airways. They have adenoids, which are enlarged. There are people, well, there are different things, but no, snoring, pneumonia, not really, no. Pneumonia will cause difficulty in breathing.
Really difficulty?
Yes, not snoring. Yeah.
Because, you know, you have that experience where someone is thinking, probably my partner is struggling, and for them, they don't mind. You just wake them up and tell them, by the way, you are snoring. They don't even know what's going on.
The people who have something called sleep apnea.
Sleep apnea.
That causes snoring. Yeah. But that you'll have to come to hospital to be diagnosed. Then you'll be given how we can manage it.
All right.
Yes.
So do not label anyone that they have pneumonia just because they are snoring. Yes, do not label them that. We have very many questions coming through. But before we go to the next question, our viewers want to understand what is the latest technology or developments in our current age? Because you realize you've said pneumonia can be treated, it can be managed. In this digital age where we are seeing a lot of technology, telemedicine, apps coming up, you know, people are wondering, you know, what is in the health sector, what are the new developments and how can you identify pneumonia? You talked about late diagnosis being really terrible. So can you, with technology, can you identify it early, something like that?
Yes. So of course the chest X-ray is the first thing, which has been there for a long while.
Chest X-ray has been for
Yes. You may say it's been there for a long while, it's not new technology, but it's very important, very crucial. In case a patient, you're seeing the symptoms are not changing, and the chest X-ray appeared normal. Because the people who, depending on when they presented, the effects on the chest have not yet occurred, so you wouldn't pick out the pneumonia then. The people you can do a CT scan, and there are people also like you've treated.
CT scan, that is another one, a new term. Okay, what's that technology?
So a CT scan, well, you'll see you're being put through a big machine. We've seen it in these shows for health. Yes. And it kind of takes pictures of every level of, like if it's a chest, it will take levels. Yes, so you'll be able to see clearly what is happening. In case that doesn't work, maybe you've treated this pneumonia, it's not resolving. We can also do now check things like TB, where we do this. You take your sputum, we do the gene expert. The people you find maybe they actually have a tumor. That's why they're having respiratory issues. They're predisposed to infection. So yes, sometimes you can have an infection on top of something else. So then we'll do things like bronchoscopy.
Bronchoscopy, that's another one.
Yes, where a camera goes down your respiratory tract, and then we take a sample of your lungs and we test it to see what is there. And also, actually, something I forgot to say, sometimes you can have a viral flu, then have a bacterial infection on top of that, then ends up being a pneumonia. So yes, we always have to rule out that it was not, sometimes it's not just one disease you're dealing with. The people we're dealing with, maybe a child with a heart condition and a pneumonia on top of that. So we also have to rule out what we call comorbidities, other diseases that come with, that can be there at the same time.
Okay.
Yes.
Oh, that's great information for you, right here on Faith Today Television. Again, we have very many people coming in. Someone is asking, good morning, I am watching on Facebook. Can I treat pneumonia at home?
No. No. I will not advocate for that.
You will not advocate?
Yes. It takes very few minutes to come see the doctor and get treated, especially at our facility. We take a very short time to treat you. Yes, so you'd rather be safe than sorry, any day. Yes, so please do not treat pneumonia at home. And also because of the reason you were saying of getting drug resistance, that you're using antibiotics, but what are you targeting? Because we treat targeting something. We don't just shoot wildly and hope it works out. Yes.
It's not a guess thingy.
Yes.
You don't also want to be in a position of performing quackery.
Yes. Yes, so it's very important to come to hospital.
Okay. So you get your answer right there, our Facebook family. Thank you so much. I think that one also brings us to a question that we were supposed to, because it ties through. What is your view on traditional medicine versus modern medicine?
Okay. So for traditional medicine, first of all, do you know what herbs or what exactly are the ingredients of that thing?
Okay.
Number two, do you know the concentration of that medication?
Yeah.
And how effective it will be in destroying that infection? You can't tell, you know. And then also, is there enough research on that traditional medicine on the side effects of the medication? So it's a bit blind.
But there are people who get results after using traditional.
There are people who get
and
results.
herbs. Yeah.
It's true, they are there. But then you need a pata potea, like it's not 100%. And especially for children and for old people, I would not advocate for that. Because you see, for them, the infection can easily go, like it will develop, the progression is very fast as compared to an adult. Yeah, so I wouldn't vouch for traditional herbs. We can use them as a supplementary to the medications that the doctor is giving, but it can't be your mainstay of treatment. Okay. Yes.
And is it important for these people who are now supplementing traditional medicine to consult the doctors? Because I am understanding, you know, you can make a bomb these days, different concoctions, you know.
Yes.
So can there be any interaction or something like that? I'm just curious.
Yes, so I think it's good to consult your doctor on what you're taking.
Okay.
Because we've seen things like supplements like zinc. We've seen vitamin A is also good. We've seen, what else? Vitamin C. So there are those things, and then now we usually now say you made a lemon concoction with ginger and honey, but it's just some of those vitamins that are in those things, and that's where it's working. Okay. So it's always good to consult to know that whatever you're using ties up. Yes.
Okay.
Yeah.
Wow, this is great information. Today we would not have it if we didn't have you, doctor, here. And I think that takes us back to, now let's go to the next level. Before I go to the next question here, children, that is a vulnerable group. Children and, you know, and the elderly. Why is it so important? Why are they at risk of pneumonia?
Yes. So they're at risk of pneumonia because, first of all, of their immunity levels. Okay. The immunity levels are altered, especially children under 5 and adults over 65. Also, the aspect of nutrition comes in for both these groups. Because you find older people, you have to keep following them. Did you eat? Some of them refuse to eat. Or if, let's say, you've left your parent, well, now who's a grandparent, with a caregiver, they are not very keen on what they're feeding them. Same for children. So in terms of nutrition, in terms of immune status, in terms of even self-awareness.
Self-awareness.
Yes. Okay. Children are not self-aware. They wouldn't know that I'm not okay. You just notice my child is not feeding or they're breathing funny. So you have to be very keen. Same with the older people. Some of them get dementia or Alzheimer's. So their mental status is also altered. So they're also not able to take the best care of themselves. So those groups are very important. And even for the older ones, of course, the things like diabetes, hypertension, heart failure, renal failure, all these things come in. Somebody has been a chronic smoker, chronic alcohol user. There's all these things going on in their bodies. So that's why they are most at risk. Okay. Yes.
Oh, this is great information. So there are age groups that you do not really want to compromise. She's telling us our children, she's telling us the elderly people. If you are really focusing on giving them the best support, it's important that you are interacting with the doctors because they have the best kind of information and support that you need. Thank you so much, doctor, about that. Let me go back to the questions of our favorite viewers. This is coming in from my baby. She's saying, my baby keeps getting pneumonia. What should I do?
Yes. So first of all, have they identified the cause of the pneumonia? Is it just the usual pneumonia, or there are other things the child has that are predisposing them to the pneumonia? So that's one thing that they have to rule out. The second thing is nutrition status of the baby. Is this baby malnourished? Are they adding weight well? Have they gotten all their vaccinations and the other supplements like vitamin A? So there's also that to consider in children. And then, of course, if you live in a home where you have older kids who are going to school, then every time those kids get a cold, then they bring it to the baby at home. So there's also that, which there's not much you can do in terms of the kids getting them in school, but supplements, diet, and of course close follow-up with a doctor helps. and of course rule out if there's other issues the child has that are making them predisposed to the pneumonia.
Oh, that is awesome. Talk about this close follow-up with the doctor.
Yes.
You know, I'm also just imagining the people who do what we call doctor shopping. You've heard about that? They move from one doctor to another. What do you have to say about that?
Well, of course people have their reasons, because sometimes maybe you went to this doctor and you didn't get the satisfaction you wanted. So,
but do you really advise that?
No, doctor shopping is not a good idea. It's good to find one good person and work with them, which can also be difficult. Yes, so I can welcome our people. JCK is a good place. We have good doctors.
Okay.
Yes, and we are very consistent in our follow-up. And actually, like our clinic for the children wellness, they're very good at what they do.
Okay.
Yes.
Wow, that's good. Another question from our viewers. I'm Anne, she says, can pneumonia bring convulsions? I'm very worried that my baby convulses whenever she has cold.
Yes, the reason for the convulsion, especially in children under 5 or even 6 years, is because of the fever.
The fever brings the convulsions?
Yes.
Okay.
The body is not able to regulate that high level of temperature. That's why they end up having convulsions. But for convulsions, we have to be sure. Is it a febrile convulsion, a convulsion caused by a fever, or is it meningitis?
Meningitis?
Yes.
That is the disease of the what?
There's inflammation in the brain. There's a layer in the brain called the meninges.
The meninges.
A membrane that becomes inflamed.
So that is the layer that protects my brain.
Yes.
Okay.
Yes. So we have to rule out, is it meningitis or is it just pneumonia? And actually for meningitis, some of the bacteria that cause pneumonia cause meningitis. And the children who it started as pneumonia then progressed to meningitis.
It started as pneumonia,
yes.
Then it worsens.
Yes.
Are those the complications?
Yes, it happens. So you need to know why. But children under 5 having convulsions usually is the fever.
Okay.
Most cases. Over 5-6 years now we start thinking of convulsive disorder.
Okay.
Yes. So when your child has high fevers, please, paracetamol is your friend, which is easily accessible over the counter. Just give them paracetamol, age-appropriate dosage, which at least either the pharmacist can tell you or the pamphlets usually tell you, children to this age take this amount. That is the first step in helping to prevent those convulsions as you go to the hospital.
To the hospital. I like the transition, because someone will be like, doctor talked about paracetamol. I have gotten it. I think I can rest.
No.
I think that's...
Yes, it is just a fever like are a sign of a bigger problem.
Okay.
Yes.
So
because really a child with a fever, that is blood infection. We have to give antibiotics.
Okay.
Yes.
Wow. So do not self-medicate. Do not treat from home. She has told you the first aid you can do, but as you go to the hospital. Let us get to... I hope that, Anne, you've really gotten an answer for that. And then we have another one from Sharon. I am Sharon. I'm watching on YouTube. I hope that you have even subscribed, Sharon. And my question is, how long does the coughing last?
Coughing from pneumonia?
Yeah, you know, people are wondering. They are trying, I think, to marry. We had TB the other time, now we have pneumonia. Yeah. So they want to know the duration.
Yeah. So what we call a chronic cough is a cough more than 2 weeks.
More than 2 weeks?
Yes.
That's chronic?
Yes.
Yeah.
And if by the time you've had a cough for over 5 days that is worsening or no improvement, you definitely need to be treated. Yes. So at least more than 5 days with worsening or no change, you must get treated. But if it's over 2 weeks, now we are thinking of TB or other issues. Yes.
Wow, this is great information, guys. I think we really need this show. It's very timely. And those of you who share this with your family and friends, you don't know which person you might save this kind of information. And thank you so much. Again, questions are really many today. I hope that I answer you, my favorite viewer. Where should I start now? Okay, someone is asking, I heard that kids handle pneumonia better than adults. How come? Someone is wondering. I heard that kids handle pneumonia better than adults. How come? I think this one is trying to relate with, you know, there are very many pneumonia cases among children. Yes. So he's wondering why is it that...
Well, I would attribute that to the fact that, first of all, for children, I'd say their bodies are fresh.
Yeah.
They've not really been exposed to a lot of things. They've not used drugs. They've not you know, the exposure, their bodies are still growing.
Yeah, yeah.
So of course now there's room for those adaptations to diseases.
Yeah,
and
yeah.
yes, they don't have a lot of like comorbidities or any underlying issues. A child who's healthy will respond very easily to treatment and all that. So I would attribute it to that. That they don't have, their bodies have not gone through a lot yet.
Absolutely.
Yes.
And also probably because of the information that mothers get from platforms like this.
Yes.
And also those who attend healthy talks,
Yes.
they're a bit conscious.
Yes.
But you know, imagine a gentleman, men really, we have that challenge. We really go for, you know, checkups, and then probably that is why we respond poorly. We get into the severity that you talked about. Oh, that's a good one.
Yeah, because a mother will actually go to hospital early if the child is sick.
Absolutely.
And the children have gotten their KP vaccinations. Yes, they've gotten their Haemophilus vaccination, they've gotten their pneumococcal vaccination, so they're well covered. They've already been exposed to the bacteria, their body already has an immune response to it. So even when they get the cold, the reaction is so fast.
So fast.
Yeah.
You talk about vaccination coming in handy. Tell us, when should I get vaccinated? Do even adults require vaccination? What are the benefits and what are the risks if I don't get one?
Okay. So vaccinations, first of all, let's start with children. There are those, we call them the KP guidelines, the KP immunization schedule that has been made by the government that has actually made a difference in the health of children in this country. Yeah, we know the others like polio, the meningococcal vaccine, there's so many. They have made a very big difference.
Now, killer diseases.
There are many.
There are many.
Yes.
Telling you.
Yes. So those have made a difference in the children's health. Then for adults, a generally healthy adult does not really need a flu vaccine. Unless you've seen like you're having recurrent infections, or like whenever the flu season comes, it really wears you down, then you can consider a flu vaccine. Adults over 65, yes, that one we really recommend that they can get their vaccines, because the problem is when they get the infection, the effects are so much more than a young healthy adult. So we're just covering them. Because you see, basically a vaccine is just pre-exposure. You're exposed to something at a low dose, the bacteria at a low dose, your body forms an immune response, so that by the time you actually get it, your body is able to fight. So of course the outcomes are good. That's why we promote vaccines. Yes. Same thing like with the COVID vaccine. Those who got vaccinated, especially those in those older age groups, people with diabetes and all these other conditions, it made a difference in the outcomes. It made a very big difference. Yes.
I think something that is coming so handy from what doctor is saying, that even adults can be candidates for the vaccine. 60, 65 and above, you know, you can get one just for your health. All right, doctor, this is very exciting. Questions are really coming in, so many today. Someone is asking, I had, that one. Good morning. I'm used to treating my cold with pharmacy medicine. Are there risks? This is James. James is asking, I am used to treating my cold with pharmacy medicine. Are there risks?
Yes, so, well, for the common cold, that's what I was saying, depending on your symptoms, depending on the test you've done, you can say it's severe pneumonia, it's pneumonia, or it's just a cold. Just a cold does not even need antibiotics. You need now those honey, lemon, ginger. You need probably your antihistamines, things like that that will help supportive care for you to go through that. Even for viral pneumonias, most of them are not very severe. But now if you're having things like fever, general body weakness, distress when you're breathing, you're unable to breathe well, then definitely you need antibiotics. So antibiotics over the counter is not advised. And again, we repeat, because of drug resistance. Yes. When you start getting resistance to antibiotics, by the time you need help, how will we help you? And most medications you're not responding to. So that is the risk of treating over the counter. So if it's a common cold, fine. But if you're starting to get now these other symptoms, please just go to hospital.
Just go to the hospital.
Yeah.
No argument. Thank you so much. And now let's engage another gear, and then probably talk about the healthy workers, you guys at the forefront. What are some of the challenges you are facing when you are diagnosing pneumonia and also management?
Okay. Some of the challenges first are that over the use over-the-counter medications, because somebody will tell you, I already gave my child amoxicillin for 5 days and they're getting worse. Then now we have to escalate.
Okay.
Yes, so and you are the one who made decision to give your child amoxicillin, and it didn't work. So that is one challenge we're having, the drug resistance.
Okay.
Number 2, there is also socioeconomic factor. You'd like to give this person the best care, but they cannot afford it. And it's such a difficult situation to be in terms of ethics, in terms of humanity, because sometimes a child is very sick, or even an adult, they're very sick, but they cannot afford the medical care that they need.
Yeah.
So those are also another challenge. And what else? Yeah, those are, I think, are the main things.
I think they are. And also...
And then, of course, coming late for treatment.
Coming late.
Yes, because now a patient dies on your hands, you're left with this guilt, but you know it's not your fault. You took long to come to hospital. How am I supposed to help you?
I know.
Especially for babies. I have seen too many babies die, especially in the public setup, because you came late. We give you strong antibiotics, we go to the next level antibiotics, nothing is working, it is too late. So that is also another challenge. That you have to carry that, like the child died then.
I know.
But it's not your fault.
I understand.
Yeah.
In practice, it really haunts, you know. And for our viewers, you really get the facial expression and the kind of argument she's trying to make. We put health workers at a very serious, bad position. When you have tried all that you can and you have failed, when you come to them, you expect them to really fulfill and do miracles. And sometimes it really doesn't work out. So she's really telling us it's a challenge. It's a challenge. So the remedy is, when you discover that it could be this, anything unusual, please rush to the hospital. These people are ready to help you and help you go through this. Speaking of that, as we conclude, I want you to speak to the parents out there, you know, who are having these kids, and the elderly group. You know, those are the vulnerable groups that we want to really galvanize and really give quality information. How are they going to prevent this pneumonia? How are they going to go through this? Give us some quality information in that line for this vulnerable group.
So the first step in prevention is vaccination, which we've talked about. Number 2 is diet. So let's be very clear on the diet. If you need to get a nutritionist to help you, do that, please. You know, even like you notice there's differences in our tribes, how we feed in our families. You find some tribes where they are doing well and there are some which are struggling a bit.
Dieting,
there are people,
tell us about dieting.
Yeah, like you find people don't believe that a young child can be given proteins, because, you know, maybe they don't have teeth or whatever, but you can give eggs, you can give mincemeat, you can give liver. There are things you can give, you can mash them and give them. Because there's always that mentality. You find people are giving only carbohydrates, malenge, potatoes. There's no proteins. Yes, so a balanced diet is everything.
Balanced diet.
Yes, and then clinics. Children under 5 should go for their full clinics. Because even in these clinics, especially you find after like 2 years, there is no more vaccinations. I think the last one is at 1.5 years. After that, we give them vitamin A. And then on top of just the usual monitoring of weight and height, that can help really guide you on what do we need to do for this child. For the older people, most of them have comorbidities. So that follow-up with a healthcare practitioner who is able to also pick up other issues. And of course, like for the older people and even for the young ones, I know we always have challenges with the health caregiver, the person taking care of the, not the health caregiver, the person taking care of the child, the caregiver. So also be keen on who you're leaving your aged parent with or your child with. That will make a difference. And of course, ventilation, because if you're in a closed space and it's an airborne disease, you will all get it. So if in the house, you'll say, the child brought it from school, gave the baby, now they've given you the parent. So of course, ventilation in our homes are also very important, hygiene. And if you know you have a cold, please wear a mask when you come in public. Don't come giving us the cold. We don't want to get the cold. Yes, and for some people who have comorbidities, we'll go to pneumonia. So let's also have that personal initiative. If you know you have a cold, just wear a mask. It's just for a few days, your cold clears and you reduce the spread rate of the cold. Yeah.
Wow, thank you so much. I enjoy getting this information right from a doctor. And in your, as we conclude this, parting shots, you're going to look at the camera and then give a word to our viewers.
Okay.
Yes.
Yes, so in conclusion, pneumonia is a leading cause of death. It's very treatable with early diagnosis, prevention like with vaccines, if you watch our diet, and management of other health issues. Also self-awareness. If you know you have asthma, you have a heart condition, you have lung issues, just be aware that you are at higher risk. So take good care of yourself. And yes, it's a very treatable condition. We should not be talking about death at this day and age from pneumonia. It is very unfortunate when you hear such cases. So please get medical care at the right time. Yeah, thank you.
Wow, thank you so much. That has been Dr. Jackline from JCK Hospital, sharing such invaluable information concerning pneumonia. Nobody should really die of pneumonia. Pneumonia should not claim lives in this modern age. And of course, for those of you who are following us, this is very key. The summary is pneumonia can be prevented, it can be treated, it can be cured. We can deal with this. But the key thing is early diagnosis. Early diagnosis. Make sure that you engage with the healthy practitioners. They will help you with this. And until next time, stay healthy, stay strong, stay informed, and stay safe. God bless you. Catch you next show on Faith Today Television.